Hello, my name is Dr. Doug, and welcome to my YouTube station. Here you will find ideas to help you in your personal life, whether you're a teacher, a student, a client in psychotherapy, or a person interested in healing and the community. I've been a practicing licensed psychotherapist for 30 years. I've also been a professor of clinical psychology at Antioch University, where I have founded what may be one of the world's first LGBT specializations in clinical psychology, starting in 2005. I also founded Color's LGBTQ Youth Counseling Center in 2001, located at Antioch University as well. I'm also an author of 2 books, completing my 3rd book, Education of the Heart, and had a previous history as an award-winning journalist and arts administrator and a performance artist. I co-founded Highways Performance Art Space in 1989 in Santa Monica, California. Today's YouTube is really to introduce my fall class at Antioch University to one of the required classes one must take before starting a clinical internship, Process 1. But it's also a YouTube for anyone who wants to become more familiarized with some of the basics of how counseling therapy works, its history, key book central ideas, and personalities. So I'm interested in how people in therapy or considering therapy might find this YouTube useful, and please let me know your thoughts in the comment section below, questions you have about therapy or becoming a therapist. I'm also going to make this actually into a series, so please smash that like button, and please also subscribe to get updates about new YouTubes on this topic and others. If you are interested in engaging with me in a live fashion, I am giving a monthly free talk to anyone around the world, actually, in a series at Antioch called Community Psychology in Depth, where I'm attempting to build a bridge of conversation between the work we do in clinical psychology to outer lives and even political lives today. The next talk culminates in a series on human sexuality, which I've been doing for the last 5 months. Takes place on Wednesday, October 11th at Antioch University from 12:30 to 2 p.m. live or Zoom. If you come live, you get free pizza. To receive the Zoom link, look for it in the description section. Now let's get to the class and why this class is called Process 1. So I think maybe a simple way of starting is to make a distinction between process therapy versus evidence-based psychotherapy, which is very big right now. Therapy, let's say, involves work with real mental health problems that involves personality, career, family, sexuality, gender, the complexity of our lives. People who are therapists, they want to help people over the long term. That's regardless, it seems to me, of the theoretical orientation. Let's think of this kind of therapy as a healing relationship. You might use a variety of techniques, but the emphasis is on the relationship, therapist as healer. Now, we've seen a move from that approach in the last maybe 20 years. Psychotherapy has been reconfigured as a series of techniques to be applied to discrete mental disorder categories. PTSD, ADHD, for example. That's happened for a number of reasons. Drug companies said their drugs work better for psychiatric disorders than therapy. Psychotherapists wanted to prove that psychotherapy was just as important and efficacious as drug therapy. So all this research and manualization was done to prove that psychotherapy actually changes people's severe symptoms, and that can become annualized and used for insurance purposes in the short term. That's been useful to a certain extent, but it's also been limiting. While it's true that we're interested in relieving symptoms in psychotherapy, it seems to me that people coming to therapy want different things more in general. I want to understand myself better. I want to manage my emotions. I want to know who I am. I want to have a range of reactions rather than on automatic coping. I want relationship strategies. I want to understand my feelings about being queer, my gender, racial oppression, grief, learning about the past, how the past informs the present, how to set a boundary on people, with people, how to set a boundary on negative thoughts. Where do the negative thoughts come from? Why do I feel one day so good and the next day so bad? These are really the general reasons, it seems to me, with which people are coming to therapy rather than getting a cure. So opposed to think of psychotherapy as a commodity and pressure to see ourselves as technicians rather than as healers whose expertise is in relationship problems, that's really why we're talking here about process of psychotherapy. Yes, we need the empirical data to help prove that psychotherapy works as well, if not better, than psychiatry. But we also don't want to let our view of therapy be dominated in that way. Because I'm a professor at Antioch University, where the emphasis is on social justice and experiential learning, our focus has always been here on the healing aspect of the relationship. That's different than other approaches I've seen in other graduate programs and friends of mine who study elsewhere, where they're learning really about diagnoses and evidence-based approaches. So that's why our students here at Antioch are taking in their first early days a class called Process 1, or the process of psychotherapy. Later on in their career, once they're seeing patients perhaps maybe several quarters later, they'll take Process 2. So we're really bridging the whole vocation of the students with a focus on process. What this means is that we are engaged in a theory of healing that involves the process that's taking place between the therapist and the client. And this may mean different things, and perhaps I can simplify it most when I say that we can make a distinction in how we're talking between the content, which is, she did this to me, I did this to her, this is what I'm saying, I don't feel worthy, this is the content, these are the things that I'm saying to you in my conversation, the content. And then the therapist is listening to the ideas, to the feelings, to the thoughts, to the physical expressions, and the content that client is expressing, but underneath it is the process. And everything we do in therapy, and ideally even in life, is intentional and carefully considered, even in our silences, our ums, our questions, our reflections, and including some of the statements that invite the client to let the therapist know if the therapist is getting the meanings and reflections right, accurately or not, in the conversation. Did I say this the right way? Did I phrase this the right way? Do I get you? Do you feel that I'm getting you? This is a deep kind of listening that I believe is central to being human. And this is why the kind of therapy that we're talking about in Process 1 is rooted in what's called the humanistic tradition. In the humanistic tradition, we're really trying to listen to two things at the same time, which is the internal dialogue that's always taking place in our mind between different voices, and also what is then being said to our client, and then learning how to make a sort of almost sort of stereo-like understanding of hearing our own views and the client's views, and developing the capacity for the deepest kind of listening. This is so important because so many of us come from families where our feelings were either invalidated, or perhaps our parents were dominating or oppressive or quiet, and we didn't get that kind of deep engaged listening that is really the key to growing up, to being a child, to feeling good, and actually at the heart of self-esteem. So there are 3 key books that I have assigned in this class, and for you all folks to learn about, you can check them out yourself. One is by Louis Cozolino, The Making of a Therapist, A Practical Journey. Really great book. Anybody can read it. Carl Rogers, 1995, On Becoming a Person, a classic text. Must have. And Irvin Yalom, The Gift of Therapy, an open letter to a new generation of therapists and their patients. All 3 of them are really important. We will discuss cultural diversity in next videos. Let's talk about Carl Rogers, key figure. Born 1902, died 1987, was an American psychologist who was one of the founders of humanistic psychology. and was known especially for his person-centered psychotherapy. Rogers is widely considered one of the founding fathers of psychotherapy research and was honored for his pioneering research with the award for Distinguished Scientific Contributions by the American Psychological Association in 1956. While psychoanalytic work and Rogerian work overlap in their focus on the relationship and on the here and now, this was not the case in the 1940s and 50s when Rogers was coming up. American psychoanalysis, which we'll talk about in next classes and YouTube's, saw the analyst as more abstinent, more at a distance, more in a seat while you're lying on the couch. Many of the analysts were medical doctors, and they had adopted also an expert patriarchal stance, very oppressive for everyone, but especially, you can imagine, for women and people we today call LGBTQIA++ people. The basic tenets of psychoanalysis involves the relationship of the past to the present. We'll talk about that more in future YouTubes and classes. A focus on the unconscious. What the unconscious is, love and death drives, the transference and the working through of past trauma in the present through catharsis, emotional opening with the therapist. Then came the 1960s with feminism, civil rights, the anti-war movement, and the gay and lesbian liberation movements. Carl Rogers' works develops as an outcome of this revolutionary time, a paradigm distinct from the psychoanalytic frame. Rogers and his followers developed a non-directive, more egalitarian, client-centered approach. This was aimed to promote growth in individuals. The therapist would rely more on the client for direction rather than being an expert. The focus would be more on the present rather than on the past, more on potential rather than sickness and pathology, more on the ability of the therapeutic relationship to provide a human experience rather than an intellectual one. Therapists could not know more about the functioning of their clients than their clients. Still a revolutionary idea. The idea here, of course, in humanistic therapy is the clients have a self-creating tendency towards self-actualization. All they need, the thinking goes, is the provision of a good relationship. The ingredients of a good relationship are genuineness, positive regard, and empathy. Very important. This is the experience of another human being trying their best to listen and constantly checking the accuracy of their understanding in a caring and gentle style. The therapist's openness, availability, expressiveness, and faith may all serve to validate a person's sense of worth. The person-centered approach is non-authoritarian, as you can imagine. Key interventions: reflection of what's being said, clarification of whether I got that right or not, and checking perceptions. Discuss that more in later classes. We will also talk a lot more about how to do Rogerian therapy as the class unfolds and new videos are produced. The next book is Louis Causalino, The Making of a Therapist. This is also a really important person. Sorry, they're all male, but we'll get to more diversity later. 1953, an American psychologist and professor of psychology at Pepperdine University. He holds degrees in philosophy from the State University of New York at Stony Brook, theology from Harvard University, and a PhD in clinical psychology from UCLA. Very important, also writer of neuropsychology. He's conducted research in schizophrenia, the long-term impact of stress, and child abuse. This guy's extremely well published, but I think you'll like this book because it's super, super practical and just really, really easy for beginning clinicians and interested viewers to read. You can see from its table of contents that it's not quite so feely touchy as Rogers, but it really is practical, addresses the anxieties, and believe me, there are many of the beginning therapists. Here are some table of contents. What have I gotten myself into? I have no idea what to do. Giving yourself permission to not know, so key in being a therapist. Desperately seeking symptoms, but no symptom solves the problem. Dreams of a messiah, no messiah, And here's a little bit from the book. Our society is almost, quote, entirely action-oriented. We measure our worth based on what we've done, what we are doing, and what we plan to accomplish. We carry appointment books, digital organizers, beepers, and cell phones. Who has a beeper now? And all our heads are filled with the sounds of voices, music, and traffic. Okay, a little old-fashioned. In the whirlwind of activity we call our lives, listening has become demoted as passive non-activity. Ironically, while all this is going on, we all along crave to be listened to by a caring and attentive others. Same thing as Rogers. When I eavesdrop on conversations, he's saying, I am often struck by how little people pay attention to one another. So true. What passes for conversation is often alternating monologues. Key concept. That's why therapy is all different. Each person uses the other to trigger their own thoughts and associations. We don't do that in therapy. We begin by being open and curious about your client's thoughts and expectations about therapy. Consider asking questions like, have you been in therapy before? What was it like for you? What do you think of therapy and therapists? Do you have other people who have helped you or hurt you in therapy? What do you hope to get from our time together? Very key question. Now, to the clinician, do you have basic listening skills in the first place? Ask yourself some of the following questions. Are you able to tune out distractions? Can you avoid interrupting your clients? Do you communicate interest through body language, facial expressions? Do you read between the lines and hear the emotions behind the words? Great questions. The things people most need to do in therapy are related to attachment, abandonment, love, and fear. We are trying to access basic emotional processes that are organized in primitive and early developing parts of the brain. The language of these emotions is also very basic. It is the language of childhood. The more complex the language and ideas you bring into therapy, the more likely you are to stimulate your client's intellectualizing defenses. The very thing we don't want to do. The role of KISS, keep it simple, stupid, may have been developed for design engineers, but it works very well for us too. Considering the difference in the following two ways of talking to a sad client, he's giving some examples. You could say, quote, I can see that you aren't as happy today as you would like to be, and I'm wondering if you would say that you were feeling blue, depressed, hopeless, or anything like that, or have felt like that over the last few days or weeks. Good question. See, no advice giving, no interpretation. Or you could simply say, I'm sorry you're feeling sad today. Good process, thoughts, interventions. Or if you're hearing a client struggling with his relationship with his father, you could say, quote, your relationship with your father is problematic. There is competition between the two of you, and it always feels like he is grading your achievements. It's so hard to know whether he cares for you or that you make him feel better about himself when he takes credit for your accomplishments, end quote. Or you could say alternatively, quote, you wish your father would love you, end quote. These are just different ways that he's saying you could approach a situation. Most of all, it's okay to be confused. Being confused with your client and collaborating and discovering answers can be an excellent approach in therapy. Genuine collaboration requires that you relinquish some control. This may be extremely difficult. I'm quoting from him. If you feel you need to be the one with all the answers, that's not going to work in therapy. Have you responded to others in your personal relationships may yield important clues about how your need for control, how you tend to maintain control, your level of comfort with ambiguity and confusion. Very important. We'll talk more about that in future videos and in class. Ask friends and loved ones for feedback in these areas. How good a listener or bad a listener are you? And listen to what they tell you. The last book is by Irvin Yalom, The Gift of Therapy, an open letter to a new generation of therapists and their patients. Very good basic books. Again, I apologize for the lack of cultural diversity, but we'll get into that in future YouTubes and in future class discussions. born in 1931, Jewish and American existential psychiatrist, emeritus, big shot at Stanford University, author of tons of books, fiction and nonfiction. He's known for developing a key Bible on group psychotherapy, and is known also for his existential approach. And here is a selection from his work, but there's so many great selections. I'm just going to pick one. He makes this nice distinction between process and comment, process and content. What is the difference between process and content? Content is just what it says, he says. The precise words spoken. The substantive issues addressed. On the other hand, process refers to an entirely different and enormously important dimension, the interpersonal relationship between the patient and the therapist. When we ask about the process of an interaction, we mean, what do the words and the nonverbal behavior as well tell us about the nature of the relationship between the parties engaged in the interaction? He continues here, if my therapy sessions were observed, one might often look in vain for lengthy, explicit discussions of death, freedom, meaning, or existential isolation, his key concepts. Such existential content may be salient for only some, but not all patients, at some, but not at all stages of therapy. In fact, the effective therapist should never try to force discussion of any content area. Key. Therapy should not be theory-driven, but relationship-driven. See how all of them are focused on the relationship. Okay, folks, so that's all now in terms of some of the basic ideas for the class and some of the books I want you to look at. Look for subsequent videos I'm going to make in the next few days about Rogerian interventions per se, the three orientations we use here, Rogerian, psychodynamic, and CBT, and also a very important video I'm going to make on incorporating cultural diversity for racial issues, diversity issues, gender issues, and LGBT people. So please don't forget to subscribe to get those future videos, and please also don't forget, or please feel free to make some comments on the comment section about how you feel about therapy. Have you been in therapy before? How do you feel about being in class? How do you feel about your professor doing a YouTube for you for class? I'm sure that's very interesting and hopefully novel and stimulating. And also, if you want to go to the talk on October 11th, either in person to get some free pizza or through Zoom, there's a RSVP link in the description section. I'm so happy to share these views with you. I love this material. I can't tell you how excited I am to discuss it with you, but also how to be a professor for this class, Process 1. I can't wait to meet you all in person. For those of you who are going to be meeting with me live and virtually, please subscribe. Please look forward to future books and ebooks that will be coming out. And I am going to be discussing actually the specifics of Rogerian psychotherapy and the interventions in the following video. Thank you so much for coming and for listening. Your being present is really appreciated. I hope you are doing your inner work and taking care of yourself, and I'll see you next time.